Welcome everyone to today's presentation, Kidney Joint Replacement Surgery and New Options for Pain Management. In this, we're going to be discussing more of the medical management and medications. A little bit about myself. I'm a doctor of physical therapy with over 40 years of career experience. I specialize in orthopedics, so very familiar with the joint replacement patient. Pharmaceutical therapy is the most common medication intervention used to treat the elderly. So some of our objectives today is we're going to understand some of the things used for our joint replacement patient, the use of lower extremity nerve blocks to reduce narcotics for pain. We're also going to talk about some of the conventional pain management, pros and cons. We'll take a look at tranexamic acid for lower extremity total joints, which help reduce the need for blood transfusions. We'll look at some long-acting, non-narcotic pain cocktails given for lower extremity joints. We'll also be discovering some online tools for pill identification, possible medication interactions, factors contributing to prescription opioid addiction, which used to be the most common form of pain management. And then we'll also talk about the importance of Narcan. So pain and inflammation are managed by these common type of medications. So in orthopedic management, we're going to look at our perioperative blocks for pain management, our pain cocktails. So we have different operative analgesias. So we're going to take a look first at some of the perioperative analgesic techniques used for lower extremity, hip and knee replacements, very common. The use of tranexamic acid or TXA can help reduce the need for post-operative blood transfusions. Now, as you heard mentioned, DVT is a problem that can be a post-op complication. So that means use of blood thinners. And there are some different types, information on the vitamin K antagonists versus the heparin. There's some of the things they talked about are different new oral drugs. There's our injectable drugs that we can give. They can be given and administered at home. All right, effects of smoking on circulation. So smoking is a disaster waiting to happen in the post-operative patient. More people are addicted to nicotine than any other drug. Now we're going to look at perioperative, which means kind of after the procedure is done, but before we close up and get out of the operating room. All right, now we're going to talk about some of those other drug classifications. They may be taking different systemic drugs or arthritis medications. So kind of a quick overview, our anti-anxiety medications. We have our different anti-anxiety, depression drugs, hypertension medications, and let's look at some of the most common ones that your patients are on. Now, the second most common category for our joint replacement patients of that age to be on is the diabetes medications, muscle relaxers. So some of our muscle relaxers. So here's our schedule 5 here. Now, drug allergy symptoms we have to watch for in our patients. Peak plasma level is the time for the drug to reach peak concentration. So half-life is the elimination half-life of a drug. It's defined as the time it takes to reach the concentration. Steady state, that's going to be our Coumadin. Remember, it takes 3 to 5 times or 3 to 5 days to build up an effective level in the body. A lot of medication factors. So when we have somebody that's had a joint replacement, we need to assess some of these things. So there are 3 key concepts when we have a patient. Now, other factors with their compliance, we trust our patients, but we have to verify or re-verify on every visit. Well, how do we keep all this stuff straight? So today, we have the ability to have electronic references. And a lot of times when our patients have pills that are just laying around in different cups or bowls, they forget what they are. So this is where it comes in really handy. Let's take a look at some of the other things that are kind of old school pain relievers. They're still in use today are narcotic pain relievers. So very high addiction potential, especially if combined with some of our other medications. So prescription opioid addiction is, this is prescription. Remember we talked about the number one addiction was nicotine. This is kind of the deaths from prescription. So what is this Narcan or naloxone? That helps reduce or reverse the effects of an opioid overdose. So hopefully that has been informative on some of the things that they are using now to help manage pain, some of the things that they have used in the past and some physicians still use on the opioids. You can see why we have tried to develop more non-narcotic ways of managing pain, much less interactions, much less side effects, and that all those little tools there, all those websites and apps will help you carry around answers to questions in your pocket and very reliable. You can check interactions. Somebody doesn't know what the pill is for, we can look it up, the interaction checker. So it's been my pleasure presenting this information to you, and hopefully you found it beneficial and informative. Always pays to keep abreast of this. This is a nice way of, it's a lot to remember. So those different drug apps, and again, my favorite is drugs.com. I have no invested interest in them, except that I've used a lot of these. I find that the most user-friendly to use. All right, so thank you for attending the webinar.
Thank you very much, Dr. Terry. And this is the finals of the session, and you may all disconnect now, and you may all have a good day. Thank you very much, Dr. Terry. Bye-bye.
Thank you. Bye.